In this video series, we will demonstrate the components of a rheumatology exam of the wrist and hand, beginning with a brief overview of anatomy. To begin, there are a number of important bony structures, including the radius and ulna of the forearm, 8 carpal bones, 5 metacarpal bones, and 14 phalanges, 2 of which are in the thumb and 3 of which are in each of the 4 fingers. In regard to joints, there are 3 articulations that make up the wrist joint: the radiocarpal, ulnocarpal, and distal radio-ulnar articulations, as well as many small articulations between carpal and metacarpal bones. Important joints of the fingers include a metacarpal phalangeal joint, or MCP, for each finger, as well as a proximal interphalangeal joint, or PIP, and a distal interphalangeal joint, or DIP. Important joints of the thumb include the carpometacarpal joint, or CMC, as well as an MCP joint and an interphalangeal joint, or IP. Each joint has a synovial capsule and several ligamentous structures over top of it to provide stability. Important soft tissues include the finger and wrist flexor muscles and tendons anteriorly, as well as the finger and wrist extensor muscles and tendons posteriorly. Other muscles include the thumb muscles and tendons, which are located laterally and in the thenar eminence on the hand, as well as the pinky muscles and tendons, which are located medially and in the hypothenar eminence on the medial side of the hand. There are also some intrinsic muscles of the hand as well. Other important structures include the radial and ulnar arteries and the nerves of the hand and wrist, including the median nerve that runs through the carpal tunnel. With these structures in mind, we can begin our examination of the patient, starting with inspection.